You're listening to Sports Psych Talk. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect any affiliated organizations or institutions. This podcast is for informational and educational purposes only and is not a substitute for professional advice, diagnosis, or treatment. If you're facing mental health or medical concerns, please consult a qualified professional. Sports Psych Talk does not accept responsibility for any actions taken based on the content shared. Reproduction or distribution of this podcast without permission is prohibited. Thank you for tuning in, and we hope you enjoy today's episode.
Hello everyone, welcome to Sports Psych Talk, India का अपना sports talk show, and today we have Dr. Sanika Divekar with us. Welcome Sanika to the podcast.
Thank you so much for having me, Karanbir. Exciting.
So I'll take a moment to introduce you to the audience. So Dr. Sanika is a qualified sports and performance exercise psychologist. She is currently serving as head of sports psychology vertical with AMP. If I'm not wrong, it is the Empower, the initiative by Aditya Birla, and where she lead the clinical practices, build up these psychological strategies to help the the clients over there, and help them also in our business development strategies. In this role, she basically establishes and scale the vertical from the inception, design the evidence-based mental performance programs over there, build strategies, partnership. She also hold doctorate in sports and exercise psychology from Glasgow Caledonian University. She done her master's in psychology from Brunel University, UK, and she done her graduation in psychology from University of Mumbai. And overall, currently she is working as a applied sports psychologist and sports and exercise psychologist in the field, working with the spectrum of sports around, starting from badminton to cricket and equestrian gymnastics, swimming, taekwondo, and she also holds a super specialization in cognitive behavioral therapy approaches, person-centered therapy. These are techniques, some of the techniques, and then mindfulness, acceptance, commitment, compassion, focus therapy. So again, I welcome Dr. Sanika to the podcast. Thanks for giving your time.
So much for inviting me.
So Dr. Sanika, we already it's very comprehensive introduction. What I have seen that you have done your doctorate in sport and exercise psychology, and you worked for or basically your academic lineage spent a lot of time in that region, and we all know that UK, how they look into the practice and how basically serious they are about the standards of the practices. So you tell us your journey. You started from India. You end up in UK. What was the motivation behind? Who gave you the idea? Because there are many, students basically who basically because of XYZ reasons they don't know how to reach at that level abroad and then acquire the qualification from there. So tell us about your journey in psychology.
Absolutely. I think, firstly, thank you so much for having me, Karan. This is great. I mean, kudos to your effort. It's a very engaging and interesting podcast. You've given a basic introduction, but I think my journey with sport and psychology started जब भी मैं एक athlete थी. So I think it was in 2004, 2005 when my parents said कि now play some sport. I was a single child, always alone at home. My parents were working parents. So I think their idea was that let's enroll her into some kind of sport. Also मेरे family में sport बहुत common एक subject था. My father was a cricketer. My grandfather played carom and cricket at a very competitive level. My uncle was into taekwondo a lot, so that culture was very much present. So I carried that same lineage. I started playing table tennis. That was the only available sport in my school, and I picked it up at a level where I really enjoyed playing the sport. Fortunately, I started winning a few matches as well, so got into professional coaching. And I think it was in the year 2011 or 12 when I was um, sort of preparing to perform now at the national level consistently, aiming for international level tournaments, is when my coach said, I think it's time that you look at mental fitness as well. And this is years ago, where the idea was very new. We probably did not have or know enough about psychology and mindset, etc. But that was my first sort of introduction to psychology. I started working with a sports psychologist myself, and I really enjoyed the field as much. And I think I've always been somebody to बहुत inquisitive थी. I was very interested in कि why are sometimes and some matches I win very easily, but then again some players I just choke under pressure, or I can't perform very well under certain circumstances. And I think वहाँ से वो sport psychology का कीड़ा जो बोलते हैं, I think it was all set there. And I remember telling my coach and my mother that, if ever I have to do a job, I think this is what I would want to do. And I had said that very casually when I was very, very young. But I think then over time, when it came to looking at fields in terms of education, I think arts was a natural selection, because it allowed me to play table tennis still. Because of course, when you're an athlete, you sort of everything else goes on a back foot. College, attendance, and all of those, that kind of life you don't get to enjoy. It's very focused on performance and training and fitness, etc. So arts was a conscious choice, and I said, okay, I'll take up psychology, and then I'll specialize in sport. But when I wanted to specialize in sport, every time when we looked up, UK was a country that would always pop up. Fortunately, we had the means to also avail an education abroad, and I always wanted to also give myself that exposure of studying abroad. So I think that's where my masters came in. Once I went there, I realized that यहाँ पे it's a little bit more common. It's not such an alien concept. And this is in 2016-17, right? Where फिर भी it was very new in our country. Not everybody knew about it. Not all athletes had access to it. So I think that opened my eyes even more. It gave me a broader horizon to look at it from a professional and a career point of view. And तभी से मेरे दिमाग में था कि I'll go back to India, I'll work for a few years, but then I wanted to always do a doctorate in it. So I think after my masters, I moved back to India for a year and a half. I worked in India, understood what the field looks like here. Is when we started coming across to people like you who've studied here, have always worked in India, started connecting with more people. But then had the passion still that I still want to study more. I felt like I hadn't specialized enough for me to work with athletes or set up my own practice or whatever. So it was during the pandemic that I said, okay, okay, now I'll apply for doctorate programs. Fortunately, got into the GCU Psych, which is one of the very few doctorate programs in the UK. But the intention was always that you go there, you study, and then you come back and work in India. So I think that is that's more or less a little bit of my journey in terms of being an athlete for like 12 years and then studying for another close to 8-9 years again.
Just one, transitioning sort of this question popped up to my mind is, in sports psychology, we have seen many of us do not have the sporting background. You understand, the sporting background, not in terms of like you played sport. How necessary it is, how important it is that is it something that make you a really good sports psychologist, like or is it okay if you're never played a sports like never played a sport or you never been a sportsman? So how you look at it?
I think it's काफी कॉमन क्वेश्चन है. मुझे बहुत से स्टूडेंट्स आजकल पूछते हैं कि इज इट रिक्वायर्ड कि हमें एथलीट होने की जरूरत है. आई डोंट थिंक इट्स रिक्वायर्ड फॉर यू टू बी एन एथलीट. आई थिंक इट्स इंपॉर्टेंट कि आपको स्पोर्ट समझ आए, आपको समझ आए कि वो एनवायरनमेंट कितना डिमांडिंग होता है, उसके प्रेशर्स अलग होते हैं, एथलीट से जो एक्सपेक्टेशंस होते हैं वो बहुत अलग होते हैं. दे आर वेरी यंग in terms of the performance that is expected out of them. So they are a very different 11-year-old if they're a national level athlete than somebody who's not an athlete. So I think in that sense you need to understand and have a very deep understanding of the biology, the development, the socio-cognitive, emotional development, and the demands that the sporting environment places. And of course it's important for you to understand the basic rules that you would work in a sport. आपको वो situation समझ में आनी चाहिए, आपको वो language उनकी समझ में आनी चाहिए. And I think According to me, I only knew table tennis because that was my sport. But now I work with so many different sports. I think having when you step into a new sport or when you work with newer athletes, you have to spend some time understanding कि ये sport के rules क्या है, इसका progression क्या होता है, what is a typical season like, what kind of injuries could come along in a sport like this. Is it a contact sport, non-contact sport, etc., etc. I think that understanding that contextual intelligence is something that is very important as opposed to
Yeah.
you being an athlete.
I totally second you in terms of, okay, when you played a sport, maybe you more understand, periodization, training concepts, कैसे वो चीजें होती हैं. That is the sport science का aspect which you understand basically better than maybe somebody who never played a sport. For them, it become more important to go through the sport science ka understanding a little bit.
Yes.
And we see, okay, these two things are merging. Psychology in a big way. A lot of psychology is coming from one vertical, and then the sports science ka concept coming from the sports sciences ka, this thing. How you look at it?
I think it's very important. मुझे from me being an athlete and now working with athletes for like close to 7 years, it takes a village to raise a champion. बहुत लोगों का साथ में आना बहुत important होता है for that one athlete to achieve their goal, right? उसमें sports psychologist एक cog in the wheel है, छोटा रोल प्ले करते हैं. बहुत से अदर एक्सपर्ट्स हैं जिनको वो एथलीट के गोल के साथ अलाइनमेंट में होने की बहुत जरूरत होती है, इज व्हाट आई पर्सनली फील. Right from having like a physician or a medicine practitioner to right physiotherapists, strength and conditioning coaches, nutritionists, psychologists, if you have access to then biomechanists and labs etc. is very important because हर एक का एक अपना अपना एक्सपर्टीज है, हर एक का एक वैल्यू ऐड अलग है. A sports psychologist and a nutritionist need to be on a very good relationship because there's a big thing between food and mood. Right, that's how I tell all my parents and all my athletes that you can't isolate your mind, you have to treat it as a part of your entire being. So जैसे आप strength and conditioning coaches के साथ जाके muscle build करोगे, body strong करोगे, etc., you will need enough nutritional input as well because you want to work on your hydration, the right kind of food. Similarly, you come to me and we work on your mindset. Similarly, say you have an injury, you have to go to the right kind of specialist. So it does take a lot of people, and that is where it's important for athletes to have access to multidisciplinary support. And I think मुझे भी ये work experience के through समझ आया है. I think when I did the World Cup tour with the team is when I was actually privy, when I was a part of an MDT myself for a very prolonged time, and then it was actually quite eye-opening कि कितने opinions alignment में होने की जरूरत होती है. The coaches, the managers, the team doctor, all of us have to come together on one page and look at what is beneficial for my athlete right now. How can we all in our own ways help the athlete perform at their highest and optimum potential? So I have to agree with that. We alone can't be, we are never enough. We take care of one element of high performance and there are many other elements to high performance जो एक दिन पे साथ में आने की बहुत जरूरत है.
The thing, the way we look at a certain the science, because I come from science and I have studied science thoroughly during my schooling and all, and then obviously the physiotherapy, medical science, a lot of medical science which I studied. Science basically you need more and more people with a different perspective, so it grows. That is one thing. Everyone can't be an expert of each and everything. As this, it took me a while basically to change my mindset. Okay, I can't be an expert of each and everything. I need to look at my strength. What is my strength? My strength is this is my strength. Where I can associate myself, this is where I can associate this I can do, further, like longevity of you as a professional, direction you see. I can't be an expert of CBT.
Yeah, I think sorry to cut you, but I think एक point बहुत important है कि of course you want to know कि मेरी expertise क्या है, but if you understand other sciences, you will understand कि ये information, how can I use it for my athlete's benefit? If you don't understand the language that physios and SNCs and nutritionists speak or the metrics and impact that they have, you will not be able to do impactful work with your athlete. So it's important to understand their elements of work so that the information that comes out of say their assessments or their impact metrics, you can use it to your and athlete's benefit.
Dr. Sanika, you acquired actually, entire, see a solid psychology, understanding and background. And I see that you also, done PhD in sports psychology, and particularly on CBT. How you define CBT? I just want to know, is there a type of CBT intervention? The CBT is umbrella term. What it is? Explain.
Yes, yes. So basically, CBT stands for cognitive behavior therapy. And I'm going to try and keep it as simple so that anybody who watches this understands the approach. I understand it as it's a structured approach that focuses on the connection between one's thoughts, emotions, and behaviors. Right? The basic premise or the basic idea is how one thinks affects how one feels, and all of that influences how one behaves. That is my basic understanding of what cognitive behavior therapy is. You're correct in saying that it's a bigger umbrella, and under CBT now there are different waves that have come in, different therapeutic approaches and orientations have come in. I think the way that I look at it or I use it is by identifying unhelpful thoughts, the patterns of these unhelpful thoughts, replacing them with more realistic, balanced, alternative, and constructive thoughts. I think we can improve one's emotions, therefore one's behavior. And I think it's not about positive thinking. In fact, it's more about alternative or balanced, realistic, accurate thinking that I like to think about it as. And I think the way that it looks at cognition is that the basic idea is that psychological, say, problems are, say, partly rooted in unhelpful ways of thinking. And then, you get stuck in that pattern, which results into, say, problematic behavior. In an athlete context, if I have to explain it, say, an athlete perpetually experiences anxious thoughts, which tend to be more unhelpful in nature. They're going to feel more nervous, they're going to feel more agitated, they might feel more irritated, they might feel more anxious before a match. Therefore, they might have certain physiological symptoms like palms sweaty, feeling it in the stomach, vision might get hazy, the grip might feel quite loose, the body might get tighter. So it will have a physiological impact, and therefore behavior or in sport performance will get affected. So say they might have trained very well, but because of this pre-performance anxiety and the experience that they've had before they say step onto the court, their performance gets negatively impacted. And that's how I look at using CBT as an approach of intervention. And I think athletes can learn better coping methods, thereby sort of relieving these anxious symptoms, for example, or improving their quality of performance. It is very much action oriented. It focuses on current issues rather than past issues, in comparison to other psychotherapeutic approaches that we all are taught when we are undergoing like a psychology degree. And it's focused on the present. So I think that's why it suits athletes better, because a lot of athletes walk into consults and say, I'm struggling with this, help me with this. And I think that is where that solution focused orientation comes in handy. You're able to teach them cognitive skills. It's a very therapist driven approach as well. And I think it sits quite well with younger athletes. I tend to work with a lot of developmental athletes who are in talent identification programs or in that pathway of performance development. So I think in that kind of level of performance, emotional age and life stage development, I think it sits quite well as an intervention.
So I think CBT somewhere is one of the the most common and prevalent
Yes.
technique being used by the therapist also, both in a clinical setting and also in sports as well. We may not see a lot of clinical cases in sports, but there are athletes who go through a lot of the irrational
Absolutely.
thought related issues. A lot of irrationality is there among them. It is very important that through the use of REBT or CBT, these are some of the interventions we look at and unwind their mind and help them to resolve the confusion they are going through and the emotions particularly they are experiencing. Next is the how does CBT, we have seen discussed almost briefly about the use of it clinical setting, how we see the further like it get this expand basically in the real world, looking into performance. If you can expand a little bit for Dr. Sanika, for our audience, that how you step by step see, okay, there's a sports performance is there, and then there's a mental training, and where CBT stands, and we start from CBT and we have to move to that normality, super normal behavior, that is the performance.
Yes, I think that's a good question. I think while CBT definitely has its roots in clinical or psychotherapy because it was developed for disorders like anxiety and depression. If you absolutely trace it back to Beck's and the reason why he came up with cognitive behavior therapy to begin with, it was started as a treatment for depression. So it has its roots very much in the clinical setting and abnormal psychology and so on and so forth. However, the principles, according to me, fit right in with sport. So think about it. An athlete deals with say pressure, failure, self-doubt at any given time. All of these are cognitive or emotional challenges, right? It may not sort of directly translate into having a disorder, but they are somewhere where they're experiencing challenges with these kind of negative thought patterns or emotional low feeling or emotionally over and not able to regulate their own emotions, right? I think what CBT does in sport is sort of help athletes recognize these unhelpful thoughts. Say, for example, when athletes say, I think I'm going to choke, or I think I'm going to lose today, or I don't know what's going to happen to me. I don't know today कि मैं सिलेक्ट होने वाला हूँ या नहीं सिलेक्ट होने वाला हूँ. अगर मैं नहीं सिलेक्ट हुआ तो then the coach will just go at me. All of these thoughts somewhere are unhelpful for their performance. With CBT as an intervention modality over a period of sessions, over a period of after establishing that good rapport with the athlete, we try and replace them, we try and restructure them using techniques by CBT with performance focused, rational thoughts. For example, one of the most common balanced thought that has come up in my consult so far is I've trained enough for this and I can execute my strategy today, as opposed to having a very negative, emotion laden, anxious thought. And I think it is this place where CBT allows to build that mental or cognitive flexibility and establish a sense of control, which is, I think, as important as your physical conditioning is when it comes to sport performance. And I think this is how I see it translate in sports. So I tend to rely on a lot of cognitive intervention techniques, one of them being cognitive restructuring, so using thought records, thought diaries, goal setting, etc., which helps me in my sessions with the athlete to go over. So there are sometimes a worksheet having stuff to write down, have using a whiteboard to process the negative thought, etc., aids in translating the core CBT principles to sport. If that answers your question.
So that definitely helped me, to answer the question. But I have to go through I have something for you. I may read the statement of one of the athlete. I asked her to write down. Uh, just give me a moment so that we also make it a little practical. This podcast may go, in a different direction. So this girl came to me, and I was like, she was experiencing some sort of the problem primarily during the match. She said, I'm overthinking about what I asked her, okay. She's like, what if I lose? That was one thing. And she had like self-doubt. She was like have this fear of losing against short-heighted players because she's very tall. And she said that I do not feel confident in a very specific situations. Otherwise, I always have the advantage actually against my opponent. Have to perform for trials and all, and coaches are there. They are telling them something. That same thing, that you have the height advantage. That why you are so fearful against and making mistake against short-heighted, stout-heighted these athletes. Good skills are there, but she still loses her match against the stout, short-heighted. I asked her to, okay, you need to write it down, what you are trying to tell me. She said, अगर मैं हार गई तो, that was the question mark, मुझे जीतना है, I have to prove myself, सब देख रहे हैं, अच्छा खेलना है, अगर मैंने ये सर्विस की और उसने आगे मार दिया तो मैं I don't know what she's written, but maybe it will be
कि
difficult
मेरा
for
पॉइंट
her.
चला जाएगा या मैं हार
या
जाऊंगी.
पॉइंट, हाँ यही लिखा है शायद. मुझे कोई अच्छा प्लेयर नहीं मानता, मैं ठीक दिख रही हूँ क्या, मेरी बॉडी लैंग्वेज ठीक है क्या, अगर मैं सिलेक्शन ट्रायल में हार गई तो मेरा सिलेक्शन नहीं होगा, आई एम नॉट कॉन्फिडेंट. So this is what she written. Then I was like, okay, this is not sufficient. I gave her full blank page. I will, you have to write it, you know,
Hmm.
from, starting till the end.
Hmm.
If you allow me, I'll read. We may need to reconnect also. I read it for you,
Hmm.
then we will work it around.
Hmm.
She rewritten, अगर मैं हार गई तो again. So I was like, okay, now write it down, write an answer. Think of this and write the answer. What do you think? अगर हार गई तो how you will work yourself? Before I tell you, okay,
Hmm.
something आप ये कर लो, वो कर लो, ऐसा कर लो. आप खुद सोचो कि आप क्या करोगे.
Hmm.
तो उसने आंसर लिखा है. तो क्या हुआ? मुझे सिर्फ अच्छा खेलना है. आपने अपना बेस्ट देना है. मोस्टली आई ट्राई कि मैं खुद से कोई सिली मिस्टेक ना करूं और करके
Hmm.
अपने ओपोनेंट को पॉइंट ना दूं. एंड आई नो दिस थिंग कि अगर मैं कॉन्फिडेंट रही, बिना सोचे समझे खेली, विदाउट एनी टेंशन, तो मैं मैच जीत जाऊंगी या अच्छा खेल के यहाँ से निकल जाऊंगी. So this is
Right.
one thing. Yeah. And like that, there is another this thing. So I gave you the example actually. The one of the
Hmm.
athlete I am working with, and then this is what happened in that session.
Hmm.
So
Hmm.
you from your CBT lenses, actually, you done PhD. I just want you to give the,
Absolutely. I think brilliant. I think it's one of the most common issues that you and I must be seeing in our everyday consult, right? Joe, the first thoughts that you said or that you sort of read out, to me jumps ki there are a lot of questions. ये हुआ तो क्या होगा? मैं सिलेक्ट नहीं हुई तो क्या होगा? मैंने अगर ये सर्विस करी और उसने अच्छा रिटर्न कर दिया और मेरा पॉइंट चला गया तो क्या होगा? All of this sounds very anticipatory in nature, and I can see that there is there is a lot of discounting of positives, there's a lot of all or none thinking, sort of, which comes up as cognitive errors to begin with, right? It is all almost assuming a negative outcome only, right? When you've told her to first write down what are the negative thoughts, which is typically what one does when an athlete comes to us with a triggering situation. So I typically tend to use a thought record for this. We write down the situation, say अब there is एक upcoming match है और वो match को लेके ये मेरे सारे negative thoughts मैं फिलहाल मेरे दिमाग में आ रहे हैं. I also try and go into a little detail and understand that what is the emotion that you're feeling when you are writing these thoughts down, right? इसमें fear है, इसमें anxiety है, इसमें nervousness है, इसमें कोई worry है, इसमें कोई shame attached है कि अगर मैं हार गई और मेरा selection नहीं हुआ तो फिर say what will my parents think, what will my coach think, क्या मेरा funding चला जाएगा, फिर मेरे life में क्या होगा. Is there an element of all of those bits as well? Is there guilt attached to it कि यार मेरे लिए इतने लोगों ने मेहनत करी है, मैंने मेहनत करी है, but अभी उसका कुछ भी नहीं हुआ तो फिर what is all of this worth for? I see a lot of that in my consults as well. So I try and educate them in terms of emotions. I try and make them write down, and I also tell them कि write down an intensity of percentages. Say how true do you think this particular thought is right now? Say on a scale of 1 to 10 or 1 to 100, 100 being the most highest, क्या लगता है कि ये इमोशन कितना इंटेंस है आपके लिए, ये थॉट्स आपको कितने ट्रू लगते हैं, right? So I would make her do something like this. Then I would educate her. So there's a heavy element of CBT intervention is also engaging in psychoeducation, right? So you educate them about how the mind works. I typically call it the cognitive triangle, so the thoughts, emotions, and behavior. And I have developed some tools and props in the sessions that I use, and I would use that with her, educate her about the physiology angle of it, etc. Educate why we have a stickiness towards, why do we have a negativity bias as athletes, etc. And then I would connect her to the other element of thought record, which is what is the evidence, which is where the real work of CBT happens, right? How true do you think this thought is? What is the ऐसा कौन सा past performances के through आपके पास evidence है जो आपको लगता है, जिससे आपको लगता है कि ये thought मेरा true है, And I think this is where you sort of start breaking that thought down brick by brick. You almost, we call it diffusion also. So you almost diffuse the intensity of that thought. You make them think evidence for the thought and evidence against the thought as well. And it's called validity checking in CBT. And you do that with them is where you sort of start seeing an insight being built. Right, which I see her if she's written like बड़े वाले पेज पे जैसे आपने बाद में नरेट किया, I think there's some kind of insight where मैं हार गई तो I think she's written something else, or that the second vignette that you read sounded more balanced, more not as catastrophizing as the first one was. And I think that looking at the evidence for, looking at the evidence against is the second exercise that the third exercise that I would do. And then you come down to, okay, now when I think this thought, I check the validity of the thought, I diffuse the thought, and now I want to replace the thought with a more alternative or a balanced way of thinking. What would that thought be? What would those thoughts look like? For every negative alternative thought, I would encourage the athlete to write a balanced thought. Practice that in their training now. And the last element that I do is, what did you learn from this process? I think the second vignette jo aapne read kiya sounded more insightful, and the athlete usually comes up with an insight saying it's not as bad as I think. I think when I get triggered by the situation, sorry, should I continue?
No, actually, we need to reconnect. It is okay. We will maintain the same flow. No problem. This happens.
Okay.
I'm using You are trying to tell something about the where you are using CBT, and how you structure, set this maybe a little paradigm of CBT, and it is like that. But with experience also, I see that you've done PhD in CBT. So you see, okay, thoughts are there, emotion and behavior is there, and then how we create a checklist around it. But I was talking about thinking of the reflection which is missing actually. Even we try it sometime, maybe a soft CBT approach from my end. I'll call soft CBT. So how you structure it, that is one thing. That is a duration. And what if athlete tells you, like we are telling the athlete, okay, this is you have to do, and the athlete tells you, मैम फिर भी काम नहीं कर रहा, सर फिर भी काम नहीं कर रहा, मैं कोशिश करती हूँ, कोशिश बट हो नहीं पाता है, तो ऐसे केस में how you manage it?
I think ये भी काफी common concern है. I think this is where the element of cognitive behavior therapy being very therapist driven or very directive as an approach, as opposed to say psychotherapy or person-centered therapy. This is a very directive approach where you as a psychologist are very involved in the therapeutic process. I think that is where you coming in and educating them about thought changing process, how difficult it is, addressing their concern कि of course ये difficult है. It's not कि आज मैंने बोला ये pain हो रहा है, tablet खा लो, pain is going to go away. Thought changing doesn't work like that. Mindset change doesn't work like that. वरना we would have the world's easiest job, isn't it? Just to work with athletes, tell them ये कर लो, आप कर लोगे, वो match का time हो जाएगा. And I think that is also an element where you educate them that changing thoughts is a practice that you need to be engaged in, just as जितनी आप टेक्निकल प्रैक्टिस करते हो. सो जैसे आप आपकी खुद के बॉडी को ऑन अ रेगुलर बेसिस ट्रेन करते हो, सिमिलरली आपको आपके माइंड को भी ऑन अ वेरी रेगुलर बेसिस ट्रेन करना है. Right? So every time you have a triggering situation, every time you think that, okay, my thought process is I'm falling into my negativity bias trap, you consciously have to bring it back, right? And I think once you crack a good rapport with your athlete, once they get comfortable in the therapeutic relationship that you share with them, I think addressing these concerns becomes much more easier. Right? And that's why you as a psychologist have to be also very on the case. I give myself about 15-20 minutes if I can every day to prepare for my appointment, right? To go over past session notes कि मेरे athlete ने मुझे जो मैंने homework भेजा था उनको, have they done it? Have they shared it with me? What have they written? So that I also am glued in and clued in into what I can expect in the session. And that's why in CBT as an intervention, you will always have a session plan. You will always set an agenda to the session. In that sense, it's a very structured, action-oriented approach. So even if there has been a gap between the two sessions, you can still come back to listen. I think we discussed about this in the last session. Do you want to continue talking about the same thing, or is there another concern that you would want to address in today's session? Something how I would approach an athlete.
We have to keep the log of the session, but only sometime some cases there's a gap is huge.
Yes, बहुत बड़ा हो जाता है.
You
या
may
फिर
not
से athlete is
remember.
traveling, or the athlete is traveling, or they have changed academies, or they have they've moved for a few months. They've wandered to another country for a training camp. All of these logistical issues definitely hamper our work.
Yes. It is there. And okay, so we are almost about to conclude the CBT. This is not a workshop for the people, but still we are discussing very realistic examples from our work.
And practical to-dos.
It is practical also. It is very important that one should train themselves on such interventions, and then think of how you can work around the athletes. So there's a different interventions as like the mindfulness have more effect on the athlete. Then comes the mental rehearsal, imagery, self-talk, like that. We understand plus minus effect size, and then there are mood disturbances, goes on. Anxiety and all, they fall in that negative impact on the sports performance. So there are techniques like mindfulness is there. We use the very traditional conventional methods of visualization, self-talk, goal setting techniques. So do you see that CBT working all together with these techniques?
Yes, I think definitely. I think when you talk about traditional techniques, I think what you're trying to say is the psychological skills training framework, right? Where your self-talk, goal setting, visualization, physical relaxation, and all of that comes into picture. If you look at CBT literature in sport, you will see that the psychological skills that we've just spoken about come under behavioral therapy or come under cognitive techniques. Your self-talk can become a cognitive technique. Your physical relaxation can become can also sort of be encompassed into CBT. So I think their frameworks are quite similar. Their philosophical underpinning is quite similar, and that's why they can be housed under CBT. Mindfulness also is quite an improving approach. There is now a lot of research, unfortunately very little in the Southeast Asian kind of athlete population. Most of the research systematic reviews that we come across which get published are very westernized, and that's probably where we have to be a little wary to see just because it's working for somebody, some other population, it doesn't mean that it'll straight up can be applied to the Indian athlete population. We are a very different culture. We are a very different philosophy to sport, high performance, etc. So I think that is where we have to be very careful of using research in practice. But yes, mindfulness. There's also something called as mindfulness-based cognitive behavior therapy. So MCBT. Is also an element of CBT, which is very well researched, definitely in the US and the UK. I tend to use a lot of breath work in my practice, and that's probably one of the ways in which I incorporate mindfulness. But I still sort of lean more towards using CBT, compassion-focused therapy, acceptance and commitment therapy. I think those are more my go-to toolbox than moving towards mindfulness. But I see the value definitely. I definitely believe a lot in breath work. I agree that it sort of grounds you, and especially with athletes who probably experience anxiety attacks, panic attacks, an element of grounding is very, very important. And I think that's where you can integrate it in your intervention.
One common thing which I nowadays almost we discuss also, I think I also have discussed briefly with you, the use of AI and machine learning. That is a very intriguing thing which is coming up, and we all are currently witnessing and a part of this journey where AI is very much part of our life. And machine learning, which I have just discussed with one of the MIT guy just few days back, and they were like, okay, once the machine learning based on the data learn about data, then it become very automated. Then a lot of things will be automatic, and athlete will be getting insights and inputs automatically based on data you feeding to the system. And I was so surprised actually, and little bit shocked also. How you see AI, introduction of AI, and we see our role there, and we see it is now after few years, 40, 50 years, then there is no need of sports psychologists. Everything is so automated.
I don't think we'll ever come to a place, whether it is AI or any other intelligence for that matter, where the role of a psychologist will be wiped out. I think it will only enhance our work. I think it will ease our work definitely, and we have to be, at least I, as a practicing psychologist, I'm very open to what it can offer to make my job easier. So I look at it from point of view of, can it ease my assessments? Can it ease my reports? Can it help me plan an intervention? Can there be tools that I can introduce to athletes? Can I integrate an element of eCBT using available intelligence online? Can that be used to enhance my intervention? Because there's a lot of value in a human connection, in a human relationship, and I don't think any intelligence can wipe that off. I think what it can help us do is better integrate intelligence, better integrate research in our practice, and I think that is where we have to be trained. I don't think we can be closed off or be extremely traditional in our approaches. We have to be open. We have to learn it as we learn new therapeutic techniques. When something else comes up, I think we have to be open, definitely, but look at ways in which it can safeguard our athletes, enhance the psychological work, the therapeutic work that we do with our athletes. I would rather have AI take care of my note writing, or helping me keep files better. I think I would use AI more for that than in my therapeutic space.
So actually, I just want to say something. Michio Kaku is one of the theoretical physicists, and I watch him, and I also listen to other speakers. He was like, by the end of this century, that robot will be robots, and the artificial intelligence will reach at that level where they will develop this, the self-learning thing. They will be self-learning. They will have that emotions and everything. And I was listening to that podcast, not a podcast, it was a talk actually on an economic forum where other side the Sadhguru was sitting, and the Sadhguru was giving that the what the concept of he work on what is the consciousness, and all these stuff we talk about from Indian mythology particularly. And Dimichi Kaku said, the lot of things will be replaced. Yes, I totally agree with you. We need to be open and learn about these things, and how it can help us integrate into our system. I don't see the replacement, myself, that it will be replaced, but I think we will be transformed. We will be doing something else. It is not like you don't see people working and only robots are sitting there and athletes are coming. Then athletes will be robots too. Actually, the China have conducted the first robotic game just a few days back. Yeah, you go and watch. This is very interesting. The all robots were there, jumping, running on a track where humans are running. So I think robots will take care of robots, and human will take care of human. We will be there.
But what I think is there's a lot of research. I don't know if it sort of fits in the AI space, but there is definitely a lot of research when it comes to electronic CBT, right? A lot of interventions in the UK, especially in the NHS, there are a lot of studies where the intervention is uploaded, or the patients from the OPD, IPD are given access to an e-learning portal. And I think that is probably where, if integrated with tech and data analytics, I think we could use AI better, right?
Yes.
So that like athletes can have access to immediate information if in a crisis situation. I think AI-driven apps for, say, like a thought monitoring, real-time feedback, something like that, I feel is where the opportunity is, not replacing any psychologist. I don't think I'm very I don't know what the word is. I'm optimistically very positive. Like, I'm infectiously optimistic that I don't think we get replaced as psychology professionals. Definitely not.
Yes, thank you so much, Dr. Sanika. I think we have touched upon lot of
A lot today, quite
different
diverse.
branches of the one single tree, here and there. And I think everyone is going to love listening to you as well, and they will be learning a lot of things from this podcast. They will get the direction into this, diverse, unique field of sports psychology as well. Maybe we have left with a couple of things we have not touched, but I will be connecting with you, reconnecting with you again.
Absolutely. Maybe you
And
call me again if you really enjoy, and if you think there was a valuable input that's come.
no, but there are some ideas, I will be discussing, off the recording also with you. Things
Yes.
are there in place. So for my audience, I can only say, which I always tell them in the last, that go watch the podcast on YouTube, listen Spotify. If you don't have time to watch, go, you can listen to Spotify. I try to make that I record it perfectly, and there is no issues, but there are always issues with some type of
See,
issues are
technology
there.
always fumbles, Karanbir. We
Yeah,
we
yeah.
just addressed it, right?
Yes, yes, yes. So you have to excuse, and these things, and comment, like, subscribe on Instagram, LinkedIn, and Facebook, and drop your messages. Once again, thank you so much, Dr. Sanika. Have a good day.
Thank you so much.